8 patients who came into hospital without coronavirus have died with it. A tragic outcome that has left bosses here having to try and explain to bereaved families what went wrong.
It's very sad, and we would offer our condolences to all families and affected members of our local population, because people should have a right to expect that patients come into hospital and get the best possible care and that they get better.
Just a week ago, they thought they had contained cases in the Royal Glamorgan Hospital to 34, with 2 wards impacted. Now it's more than 80, with COVID in 5 wards, and the hospital is restricting access and treatment.
When you say what's gone wrong, the answer is we have to look into that, and every case that we have is then goes through a retrospective review of where they've been, who they've been in contact with, and that's bit we're working with Public Health Wales to do that sort of backtrack contact tracing in a way.
Pressure is on the Welsh Government now to ensure the testing programme delivers.
The idea that we should have a regular asymptomatic testing programme within NHS staff isn't entirely borne out by the scientific evidence and advice, but we look at where we need to do that. And because there's an outbreak in the Royal Glamorgan Hospital, that's why we are already testing staff.
It's not just hospitals that are exposed. In Caerphilly, the first area of Wales to go into a local lockdown, almost 1 in 10 care homes have been hit with COVID outbreaks. It's a worrying time for those like William Rees, whose aunt has contracted the virus.
You know, it's you don't really want to think about worst case scenarios and whatever, but when you look at the stats and underlying health conditions, sometimes it's not great.
From care homes to hospitals, the system is vulnerable to COVID, and everyone is aware that this may be just the beginning. Rupert Evelyn News at 10, the Royal Glamorgan Hospital.